I'm David E. Williams, president of the Health Business Group and author of the Health Business Blog. Welcome to episode 5 of Health Business TV. Well, it's been another busy week in the healthcare world, and it's been a major sense of deja vu for me. Today I'm going to talk about cash payments to specialist physicians, the long and slow march toward eVisits, another take on the nursing shortage myth, politics in Massachusetts, and the premium hike for my small business. First, on cash payments to specialists. Well, I've gotten used to the idea of concierge medicine for primary care. It actually makes sense, especially as I see my primary care physician seem like she's on a hamster wheel all the time. Works out to have a small or even medium-sized payment that works in conjunction with insurance. Maybe that's the reform that's needed to entice more doctors to go into primary care and to make the incomes more reasonable compared to specialty. I did an interview this week that I published with the CEO of HelloMD, which was also covered the same week by Bloomberg. The CEO there freely talks about the idea of a two-tier system and letting patients who want to pay cash jump the line to see the best doctors. Well, I can see some appeal to this, especially for those doctors and the specialties, but I am worried. It's easy to talk about a two-tier system. I'm worried about many more tiers between Medicaid, HMOs, the higher paid commercial plans, Medicare, concierge, and so on. And I think that's really not the best way to sort out and triage patients. And really, in fact, is being a doctor just a business? I hope there's more of a calling to it than that. Most of the doctors I know would fit into that category. They're not just business people. There's also a question about, I think, ethics and just best practices on doing surgery. Somebody who's so focused on the cash, I worry about, especially for someone like a spine surgery, how often they're going to tell the patient, don't bother cash-paying customer to do the surgery because you don't need it. The health plans actually do play a meaningful role there. I don't know also about how well it's going to work out working with a team of physicians who one is a specially paid one and the others are not. That I think has some problems to it. So I kind of doubt this whole model will work. Be interesting to see. The best appeal is probably to perhaps foreign medical tourists who are paying cash anyway. I first started working on eVisits more than 15 years ago, and around that time, but not about eVisits, I heard that innovations in healthcare could take a long time, 10, 15 years or even more. Now that I've been around for a while, I see it's actually been the case with eVisits. There was a big news story in the Seattle Times this week that WellPoint and Aetna are expanding their eVisit coverage. To tell you the truth, it didn't seem like such a radical idea even 15 years ago when I was first working on it with HeLinks, which later became known as Relay Health. They did a good study that showed that it worked and that people liked it. Published back in 2003. I published a link to that. Well, in 2009, when I saw a similar story to the one that I saw this week, I wrote that it's probably going to take another 10 years to get eVisits to be very common. And sure enough, 2014, we're halfway through. These predictions seem to be coming true, and I would dare to say I could have just reposted that same post from 2009 and maybe had the same effect. That's despite the fact that since 2009, we've had the iPad, Meaningful Use, Affordable Care Act come into play. So things are moving along slowly, I would say way too slowly. And another back to the future or even a recurring theme is about the nursing shortage. At best, I would say that the articles that you see periodically about a looming nursing shortage are a misreading of statistics or misunderstanding of how technology evolves. At worst, and I fear often, it's manufactured by the people who run nursing schools and want to boost enrollment. So every couple of years you see a story about how there's going to be a big glut of nurses. There's a big glut of nurses now, but just wait, there's going to be a big shortage coming up. Well, recently, in the last few years, you see those articles, they attribute it to the recession where someone who's a wife who has a nursing degree comes back into the workforce when her husband is laid off or loses a number of hours. That's kind of over now. So the latest story is about how older nurses are putting off retirement, but they still follow up and say, well, there's a glut now because of people putting off retirement, but just wait, that will change and there'll be a big shortage coming up. So my thoughts are, you don't hear about the nursing shortage. I don't hear about a nursing shortage from the biggest employers, which are hospitals. And I do think we're going to have an evolution where we'll have robots and other sorts of technology that will assist nurses. There's still jobs out there, so if you're thinking of going into nursing, don't rule it out, but don't do it because you think there's a huge shortage and there's guaranteed employment. If you followed the Health Business blog, you'll know that I interviewed all 9 candidates for governor of Massachusetts about healthcare policy. And there's really good competition at the governor level between the Democrats, Republicans, and independents. But below that level, only the U.S. Senate races is sometimes competitive. The House races are generally not. 6 out of 9 of them in Massachusetts are not even being contested this year. It's even worse when you look at the state legislature. So I've been intrigued by Evan Falchuk and the United Independent Party. I wrote a letter to the editor of the Boston Globe that was published about it today, wrote about it in my blog. And today, actually, the Globe has a story about the United Independent Party. They just need to get 3% in order, Evan just needs to get 3% in order for this party to be on the ballot more easily in future elections, much further down the ticket. Finally, speaking of 3%, I wish that was the increase that my insurance premium was going to go up this year for my small business. Instead, it's 29%, which I find a shocking number. I spoke to our sales rep, who has the title account executive, which may be a little bit highfalutin, and she gave a partial explanation, basically blamed it on compliance with the Affordable Care Act. I said, okay, well, 29% must be at the top of the range. She said, no, she's seeing people with 40 to 70% increases. Well, that's counter to my overall understanding of what's going on nationwide, although I have heard about similar stories from others with small businesses in Massachusetts. So, especially after 2 years of stability, this is pretty shocking. I'm waiting for the top Blue Cross Blue Shield of Massachusetts actuary to return from vacation next week to speak about this, so stay tuned for an explanation. Meanwhile, that's it for now. Have a terrific weekend.